There is a positive thing some positive things I want to talk about. And I think that's technology, AI, diagnostics. That's where we're getting better and better. This is science kind of beating back Mother Nature with human ingenuity. So, for example, they're using AI to understand how malaria parasites evolve their proteins, and maybe target them. For example, if you know how they're going to evolve, then you can develop countermeasures against them. Also, with malaria, they're using drones and AI to actually look in Ghana at breeding sites, standing water, to better target where they're going to drop larvicides or put larvicides. The drones aren't putting the larvicides in, humans are putting the larvicides in, but they're able to do it more efficiently now. In sepsis, people are working every day to try and use AI tools to understand who is at risk for severe sepsis, who is likely to have organ failure, how do we diagnose it faster. I think it's not quite completely worked out, and lots of tools might be overly sensitive and have lots of false positive, but I think it's only a matter of time before artificial intelligence enabled diagnostics help us to change the way we treat sepsis. And it is already happening. It's just not completely universal. AI is being used for drug development, specifically for antimicrobial resistance, understanding how to make antibiotics that might be less likely to foster resistance, how to target parts of a microorganism that are less likely to mutate, therefore preserving that antimicrobial's efficacy. That's also another great story. Other interesting things that have happened technologically, a small diagnostic machine for tuberculosis that can work on saliva and tongue scrapings rather than sputum. Many people with tuberculosis cannot produce sputum, which is the phlegm that we often do traditional microbiology tests on. This is something that can be done very quickly, short period of time, and it may revolutionize the way we diagnose tuberculosis, which is the #1 killer of infectious diseases in 2026. And then the microbiome, more and more understanding of the microbiome and its role in other diseases, not traditionally infectious diseases like colon cancer or Parkinson's disease. That's starting to be unlocked as well.